All right, it's 2:40 Eastern by my time, so I'm gonna start sharing my screen and then jump in. Can you all see my screen, the slide? Okay, great. All right, so welcome back everyone, and welcome to our final session of the day, Bias Across Our Industries. My name is Mallika Bender. I'm the Diversity, Equity, and Inclusion Staff Actuary for the Casualty Actuarial Society, and I am very happy to be the moderator for today's session. A quick note before we dive in. The U.S. qualification standards put forth by the American Academy of Actuaries now includes a 1-hour minimum continuing education requirement dedicated to what is referred to as bias topics. And that's described in section 2.2.6 of the qualification standards. So that says that bias topics can include content that provides knowledge and perspective that assist in identifying and assessing biases that may exist in data, assumptions, algorithms, and models that impact actuarial services. Biases may include, but are not limited to, statistical, cognitive, and social biases. So this session may qualify for up to 1 hour towards this new continuing education requirement. But as always, please use your judgment to determine if your participation in this session would qualify under that requirement. And you can check out the American Academy of Actuaries website for more information. I am very pleased to introduce our 4 expert speakers for today. First, Dorothy Andrews is the Senior Behavioral Data Scientist for the NAIC, where she analyzes insurance company rating models, reports to state insurance regulators about her analyses, and provides related regulatory training. She has more than 25 years of actuarial and statistical modeling experience with a variety of companies. She's adjunct faculty at the University of North Carolina in Charlotte. And in addition to her many actuarial credentials, she's also working on a PhD in media psychology. Julia Romero is the product lead for actuarial engineering and advanced modeling at Haven Technologies, where she's focused on actuarial technology and applying data science and other analytics models to drive innovation in actuarial services. She graduated from Colgate University and is a fellow of the Society of Actuaries and a member of the Academy of Actuaries. Lauren Kavanaugh provides PNC actuarial consulting on behalf of state insurance departments. Prior to joining RRC, she managed teams of credentialed actuaries and did work including reserving, pricing, expert testimony, and transactional due diligence. Lauren is the chair of the American Academy of Actuaries Property and Casualty Racial Equity Task Force. And last but not least, Stacey Lampkin is a senior actuary in Mercer's government practice, which assists state governments in their management of their Medicaid and related health and human services programs. Stacey is a vice chairperson of the American Academy of Actuaries Health Equity Committee. So if you want to know more about any of these speakers, there's more extended bios in the program for the annual meeting. But I do want to say thanks in advance to all of our speakers for sharing your expertise with us today. And to the attendees, I encourage you all to type questions for the speakers in the chat. We will have a few minutes at the end of the session to answer some questions. So we're going to kick off the discussion with Dorothy Andrews, who is going to describe some of the different categories of bias and how they play into the modeling process. So I'll let Dorothy share her screen and get started.
Thank you, Melinda, and good afternoon, everyone. Thank you for attending this topic on this presentation about some of the kinds of biases that creep into the modeling process. This is an extensive topic, as evidenced by the graphic. Each one of the questions posed has been the subject of a lot of debate and research. My presentation will highlight consensus around biases that impact every step of the modeling process. The iceberg metaphor is used to explain a lot of phenomena. The National Institute of Standards and Technology uses it to talk about 3 categories of bias: statistical, human, and systemic. Using the iceberg to represent these three categories has two meanings. The obvious one relates to visibility, and the second relates to the difficulty of mitigating them. Most people think statistics is hard, but in respect of bias, statistical bias is the easiest type to see and the easiest type to resolve relative to the other two. Human biases are just below the waterline and more difficult to resolve than statistical biases. My mother used to say, you can't change people, they have to change themselves. And that is the challenge with human biases. People have to recognize their biases and actively work to change them. Finally, there is systemic bias. Systemic biases are so deeply ingrained in our institutions and society that it would take Herculean efforts to eradicate them. History books are a good example here. Not every group is equally and accurately represented in the history books used in schools across our nation. As I previously stated, I'm going to highlight some of the biases that creep into every stage of the modeling process. This diagram is a nice depiction of the modeling process. It starts in a logical place where modeling development begins, and that is understanding the business problem needing a model, and it ends with deployment, the point at which the model becomes operational and starts affecting the lives of real people. We're going to walk through this process and discuss some of the types of biases that can impact decisions at each step of the modeling process. The first group of decisions in the modeling process involve data. We will discuss these first three steps as a group. One of the first definitions a student in statistics learns is that of an unbiased estimator. An estimator, represented by the E symbol, is said to be unbiased if it can be mathematically demonstrated to equal its true value in the population. This is the same definition in the spirit that the International Organization for Standardization uses, which defines bias as the degree to which a reference value deviates from the truth. When the deviation is zero, there is no bias by this definition. It is important to remember that statistical bias is a quantitative calculation, not a qualitative calculation. Even if this bias calculation is zero, models can still pose other harmful biases. It is important to get the math right, but we still have to look at other ways biases creep into the process. So we're going to talk about sampling, selection, measurement, and omitted variable bias, because these biases are found in the training data, and the training data is one of the two primary categories of bias in modeling, with the other being bias imposed by modelers. It sounds so easy to take a random sample. How could that get messed up? Well, the truth is, it can. Just envision putting your hand in a bag with 3 red, 3 green, and 3 pink balls and getting a sample of 3 balls that are all pink. The sample is not representative, but it didn't occur in any intentional way. The bias simply occurred as an artifact of the approach. Selection bias occurs when you select your sample from the wrong population to define a metric and then use that metric to make inferences about the larger population. For example, taking a sample from the population of basketball players to make an inference about the average height in the general population would reflect selection bias. Our estimate would likely be too high. The general population would have been a better population from which to draw our sample. Measurement bias can occur as a result of bias in the training data, where certain groups are not represented in the development of the technology, such as was true of the pulse oximeter when reading dark skin during COVID. The instrument was not trained on dark skin and gave faulty readings on dark skin. Measurement bias can also occur when faulty measurements result in data distortions. Target variables can be ill-defined for the purpose of the model, which is what we saw when a health company attempted to predict the need for medical care referrals using medical spending as the target variable. And the result was bias against people of color. The algorithm ended up referring people of color less for needed critical care than it did the white population. The metric failed to recognize the systemic problem that people of color have less access to health care, and that was the reason why spending was less. Finally, omitted variable bias occurs when an important variable is left out of the model. Omitted variables can often explain spurious correlations. Diversity of thought is important in the development of model variables and the interpretation of the results. A social science perspective may have uncovered the defects of the target variable in the healthcare example. This is the Cognitive Bias Codex, and it is a useful tool for visually representing most of the known cognitive biases that exist to date. The biases are arranged in a circle and 4 quadrants. Each quadrant is dedicated to a specific group of cognitive biases. You can find an interactive version of the codex on the internet. We're going to broadly discuss the 4 quadrants. Unfortunately, the word bias is becoming synonymous with the word bad. But as humans, we need biases to help us make sense of the world, as we will see in examining the quadrants of the codex. The codex helps us understand why we need cognitive biases in our lives. So the first group of cognitive biases helps us determine what we should remember. We can only afford to keep around the bits of information that are most likely to prove useful to us in the future. We need to make constant bets and trade-offs around what we try to remember and what we forget. For example, we prefer generalizations over specifics because generalizations take up less space. Our minds pick out bits and pieces of information that are important to remember, and we discard the rest. Think about how people used to read the newspapers. I think some people may still read physical newspaper, but I'm not sure. As an example, few people remember every single word they've read, but most remember generally what they've read. So the second group is represents biases when there's too much information, right? Biases in this category help us filter out the amount of information we are bombarded with on a daily basis. They are tricks, simple tricks to help us pick out the bits of information that are most likely going to be useful to us in some way. Confirmation bias is a good example of this. And the third group represents biases we employ when there is not enough meaning in information. Biases in this category help us by filling in the blanks with stuff we already know to update our mental models of the world. Just think of the old style comic strips that have gutters between frames. Those gutters act as invisible messengers within comics, and that they pass information but are simply empty spaces. Our minds fill in the rest to keep the story coherent. Unfortunately, sometimes when there are gaps in information, we fill in the gaps with harmful prejudices. The last group of biases is employed when we need to act fast. As humans, we are constrained by time and information, and yet we can't let that paralyze us. Without the ability to act fast in the face of uncertainty, we surely would have perished as a species long ago. With every piece of new information, we need to do our best to assess our ability to affect a situation, apply it to decisions, simulate the future, to predict what might happen next and otherwise act on our new insight. Most of the biases on this short list are probably familiar to you. I want to expand on groupthink and then confirmation bias. The American writer Walter Lippmann said, "When we all think the same way, we are not really thinking." Groupthink bias can affect the outcomes of machine learning models. When there's a lack of diversity among modelers, it is very easy to fail to consider rival explanations of a phenomenon that may be a better solution. Diversity here doesn't mean just race. Modeling requires a cross-discipline approach. This means including legal, compliance, actuarial, underwriting, data scientists, and risk management, to name a few. Often data scientists are not included and should be. They understand what is going on in communities because they study communities, and they are impacted and how they are impacted by problems and solutions. It is important to include communities in solution development to foster a successful implementation. Inclusion does matter. So this graphic really captures the meaning of confirmation bias. This bias occurs when we only consider facts and evidence that intersect with our beliefs. Confirmation bias can show up throughout the modeling process. I am just highlighting it here. This type of bias is dangerous in modeling because top performing solutions may not even get considered, especially in the presence of groupthink bias. Again, having a diverse modeling team can help mitigate this kind of bias. There are a couple of things that can be done to mitigate deployment bias. First, monitoring can help spot anomalous and undesirable effects of the algorithm. These sophisticated tools are often put in the hands of people who don't understand what is going on behind the curtain and who don't have the power to override the results. Virginia Eubanks, in the book Automating Inequality, does a great job of discussing how algorithms in untrained hands can cause harm. Second, human supervision of the human deployment of the algorithm is necessary. Often the human agents will not deploy the algorithm as intended, and as a result, introduce bias in the outcomes. Here's a lesson: the algorithm is not always the bad guy. So as an example, let's look at a real world example. Nearly all consumer devices that track heart rate rely on optical sensors that continuously monitor the volume of your blood. In between beats, there is less blood volume at your wrist, and therefore more light that is reflected back to the sensor. Blood, due to its color, readily absorbs green light. When the volume of blood is the greatest, the higher the green light absorption, and thus heart rate can be measured accordingly. Darker skin slows down the absorption rate, so a higher current is required to get an accurate reading. Skin with more melanin blocks green light, making it harder to get an accurate reading. Fitbits, Samsung watches, and several other brands rely on green lights. These lights are simpler and cheaper to use than infrared lights that power hospital-grade heart rate trackers. Green lights have a shorter wavelength and is more readily absorbed by melanin, a natural skin pigmentation that is more prevalent in people with darker skin. These trackers don't always match the readings taken the old-fashioned way by putting fingers on a wrist. The darker the skin, the stronger the current must be to get a good reading, and tracker devices, and there is no way to adjust the current. The errors in these devices can have deadly consequences for people of color. They may not detect heart rhythm abnormalities. The researchers discussed the defect in these devices is a direct result of non-representative training data. Had they had more people of darker skin tones in the sample, they may have found the defect in these devices. Well, I hope that gives you some insight into some of the biases that can creep into the modeling process. This is a huge topic, and lots of people, especially regulators, are turning their attention to this topic. Even as we speak, I got off a call just earlier today with regulators on this very topic. So I hope that was helpful.
Thank you so much, Dorothy. I think that was a really great foundation to get us all started thinking about how bias can be at play in everything we do, and it's not always bad, but it could have unintended consequences. So let's bring in our other speakers now, and I'll ask each of Lauren, Stacey, and Julia to share some of the key issues related to bias in your own actuarial practice areas, and maybe one of those key regulatory developments that Dorothy foreshadowed there just a moment ago that our audience should be aware of. So why don't we start with Lauren Kavanaugh covering property and casualty.
Great, thank you, Mallika. And just want to just acknowledge it's really exciting to be here and for this annual meeting to have occurred, and all of us focusing on all these great topics. So much of the dialogue for the last couple of years on the property casualty side has been on personal lines, and specifically on auto insurance. Many in the country require a car to get to work, and auto insurance can comprise a large percentage of household expenses for underserved communities. And so because of this, we've seen an interest among state legislators and regulators, consumer advocacy groups, and the insurance industry to address pricing and underwriting of auto insurance with a focus on addressing unfair discrimination. Much of the focus much of the focus has been on disparate impact on people of color, but the discussion has broadened to many protected classes, such as sexual orientation, disability, gender expression, religion, and others. A particular focus is the use of credit insurance scores in pricing and underwriting, given a belief that there's a disparate impact on minorities. So a number of groups have been established to really focus on this. From the regulatory and legislative piece, the National Association of Insurance Commissioners has established a special committee on race and insurance. And state legislators have also been active. So my one regulatory development would just mention the Colorado law that they enacted regarding unfair discrimination. They focused on all lines of business, including like personal lines for property casualty, and then also life and health. So Stacey and Julia might mention this as well. But the law is enacted and not yet implemented. So that work is going on right now with the insurance commissioner. The Federal Insurance Office has also been looking at these issues and looking to update their work on affordability and availability of auto insurance. And part of that is really to pay particular attention to traditionally underserved communities and the impact of non-driving factors. And I should also mention the actuarial community has been very involved too. The Property Casualty Racial Equity Task Force was established a couple of years ago from the Academy, and then also the CAS has some really good research in this area, which we'll cover at the end. But I also wanted to just take a couple minutes to just talk about a particular focus that we're seeing in property casualty, and that really has to do with getting to this question of what do we mean when we say unfair discrimination. I bring this up in this meeting because what we mean as actuaries, traditionally unfair discrimination and what might be typically understood could be two different things. So it's important to have a clear definition of both parts of this, the fairness part and then also discrimination, right? So fairness is defined in many different ways, and what might seem fair to one might be unfair to others. And so I think this is coming up in a lot of the discussions in regulatory hearings and the like. And then also the definition of discrimination. This was, as an example, specifically a question that came up in a hearing in DC on these related topics. You know, what do we mean? What do actuaries mean when they say, you know, discrimination? Because, you know, just the Oxford Dictionary definition would be the unjust or prejudicial treatment of different categories, people, or things, especially on the grounds of race, age, or sex. We typically, as a public, have this notion of pretty negative connotation to the word discrimination, right? But for actuaries, we look to our actuarial standards of practice. We look at the one on risk classification, also look at regulations, and for property casualty actuaries, look at the CAS rate making principles, and all of those kind of point to that you know, rates are not unfairly discriminatory if they're linked to expected costs. Now, of course, there are, you know, laws in place that bar the use of particular you know, rating variables like protected classes such as race and others. But really at the core, that's what the insurance industry thinks of as far as producing rates that are not unfairly discriminatory. And there needs to be a lot more focus in this area as we look at the issues of social unfairness. So for example, even if a model excludes race, which most of them would, are there other proxy variables that can pick up the same effect? So I would mention there's a paper published by the CIS on defining discrimination in insurance, part of their race and insurance series. And I really think it applies, you know, largely to all lines of business. And so we definitely recommend, if you're interested in reading more about that, to take a look at that. I'll just say also, you know, I've said a lot about auto insurance. It's not just auto. There's, you know, focus on homeowners as well as commercial lines. It's also not just pricing and underwriting, but also, you know, questions on marketing practices, claims handling practices, these things too. And so, but so right now, focus on auto pricing, but there's a lot that needs to be looked at on the property casualty side. So I will leave it at that and turn it back over to you, Mallika.
Thank you, Lauren. So all of these are going to be a bit of a teaser so that you can all go and learn more on your own time. We're going to go to Stacey next to talk a little bit about some of the key issues in the health space.
Thank you, Mallika. And thanks everybody for letting me join today and talk on behalf of the Academy of Actuaries Health Equity Committee. Really appreciate the opportunity. COVID-19 really highlighted and brought to the forefront the impact of health disparities that have long existed for disadvantaged communities. Just some basic facts, you've probably seen them yourselves if you followed the news here. The CDC has documented that people from racial and ethnic minority groups have been disproportionately affected by COVID-19, including experiencing increased risk of infection, hospitalization, and death. And just this summer, they published some shocking statistics that shared that the Black share of COVID-19 deaths has been 13% higher, and Native American share 57% higher than their relative population shares. So shocking stats producing a lot of additional attention to a problem we've known about for a while. I mean, we know that there are complex sets of barriers to high quality healthcare and challenges to good health that are disproportionately experienced in the US. Underserved, underrepresented populations have generally fared worse when we look at health-related metrics like health insurance coverage, having a usual source of care, having had a healthcare visit in the last 12 months, and the communities report self-report higher rates of fair or poor health status versus good or excellent health status. The Affordable Care Act did produce some progress in some of these areas, but there's still a lot of disparity out there. And even before COVID, there had been growing attention on social determinants of health, which are, if you haven't heard that term, those are non-medical factors associated with the places where people live, work, learn, that influence their health. And while social determinants of health are not the same thing as health disparities, there are correlations and overlapping solutions. There are also influences outside social determinants of health that affect disparities. And we know that because we have statistics, for example, like those that show worse maternal outcomes even after normalizing for education level and income. So there's hard statistical evidence of disparities in healthcare access and health outcomes. One of the major elements of the Academy's Health Equity Committee charge is to study whether there's any implicit bias in our practices as health actuaries. In examining these questions, we've organized the committee to examine practices, actuarial practices, in a variety of areas that cut across payer types. We're looking at benefit design, pricing, provider network, population health, and data use. We've talked about things like approaches to risk pooling and developing pricing factors. We've talked about whether certain plan design features that are aiming to control utilization disproportionately affect access to care. We've performed research reviews, issued an RFI, and continue to discuss collaboration with outside researchers. These are really challenging questions to develop rigorously as we look internally at ourselves and our practices. When we have little existing research on the results of the practices, and frankly, demographic data that's inconsistently collected and incomplete. But one topic I'd like to highlight today, because it is the area we've made the most progress on and recently published an issue brief on, so I'm promoting the issue brief too. And that is the use of data algorithms and specifically risk adjustment and risk assessment techniques. And this is very similar to the example that Dorothy used on measurement bias a few minutes ago. Health actuaries use risk adjustment as a predictor of relative cost that health plans may experience based on differences in the populations they enroll. Risk assessments are tools that may be used to identify individuals who would benefit from care management, for example, or other kinds of things like that. However, these tools and other risk assessment algorithms that rely on historical claims data are relying on care patterns that may reflect inequitable access to services. Does this underfund areas with unserved need and perpetuate historical patterns of service delivery? Especially if we're using tools that were developed for one purpose, like estimating costs, and we're applying them for a different purpose, like estimating need, we run the risk of perpetuating disparities. The broad lessons for health actuaries in this are educate yourself on the topic of health equity and be very thoughtful about how you use historical data and make sure you're using it in a way that doesn't bias your results. On the regulatory development front, I'm going to highlight the focus at the federal government level since that affects healthcare delivery for 170 million Americans through Medicare, Medicaid, and the Affordable Care Act marketplace products. And this is less about new regulations in place today than the upcoming focus that may produce changes soon in various ways that we practice as health actuaries. So this summer, the Centers for Medicare and Medicaid Services, CMS, published the Framework for Health Equity, covering a plan covering the decade starting this year, 2022 through 2032, that highlighted 5 priorities in this front. And 3 of the priorities are of particular interest to health actuaries. The first, and labeled priority number 1, is data. Expanding collection, reporting, and analysis of standardized data. So that the point of this is to increase our understanding of the needs of those being served, including social risk factors and changes in communities' needs over time. The second one is assessing the cause of disparities within the CMS influence programs and addressing them in policies and operations. So that means examining their own programs and policies for unintended consequences and developing solutions. Those solutions may have influence in our work as health actuaries within these programs. The third priority I'd specifically call out today is building capacity of healthcare organizations and the workforce. So this is capacity among providers, plans, and other organizations to help stakeholders meet the needs of the communities that they serve. Ideally, as this is rolled out and these initiatives are successful, that we'll see changes in how care is delivered across our populations. We've already seen CMS publish an RFI for Medicare Advantage since this framework was published this summer. And that RFI had a strong focus on health equity topics. The Academy Health Equity Committee responded to that RFI, and we're going to continue to monitor proposed regulations related to health equity and review other proposed regulations through a health equity lens as it comes out. So I look forward to hearing any questions you all have about that. But in the meantime, I'm going to turn it over to Julia.
Excellent. Thank you. I want to just first echo the sentiments of everybody else. I'm really pleased to be here today and thrilled that this meeting is happening. So I'll be speaking from a life perspective. And I think that the considerations around bias on the life side are not broadly different than those in health and P&C. Rather, we think about them over kind of a more limited set of observations and a more extended time scale. As should be no surprise, on the life side, our contingencies generally happen one time, being death. And we have a chance to underwrite or take policy actions usually very early, and then are looking to wait 10, 20, 30 years for experience to emerge. This, while we exist in a market where there are similar pressures around customer experience, I'd like to not get labs. It's more convenient. I'd like to have a kind of fully digital experience rather than have a tele interview to get more underwriting data. This creates a more limited set of circumstances where it becomes almost a conflict around how do we substitute essentially towards more automated solutions, towards more novel uses of data, while being more focused on how bias can enter the practice. Now, that is not to say that bias is somehow new. Rather, it is an increased focus. And so in the rest of kind of my time today, I'm going to focus on first, it's essentially one question from two lenses. What does acceptable mean around bias on the life side? And starting from one, our processes, and two, the data that we use. The point that Lauren made before around, causation is not necessary. Rather, you need to demonstrate a reasonable relationship between the outcome and the predictor. Again, becomes challenging as you're introducing new predictors well in advance of when you're actually going to observe the outcomes. So evaluating a life underwriting program directly can take much more time. And so we're faced with using proxies for that outcome. So predicting a correlation or using historical observations and trying to impute data, you end up in a place where you could be actually introducing additional statistical bias risks as you're trying to evaluate and mitigate your potential for systematic and human bias risks. Systemic and human bias risks. Relatedly, you're also in a place where, particularly in talking about systemic biases, we essentially have to grapple with what really is a public policy question of how possible and or desirable is it to kind of eliminate all of that bias from, say, just this lane of the world that is life insurance, versus other goals that regulators may have around access, pricing, accessibility, access, pricing, and experience. So there's a lot of discussion both around how do we measure this? What are the appropriate metrics? Are those metrics the same depending on what this program is? As Dorothy mentioned before, you have kind of a set of different exposures to human bias and statistical bias, and then the kind of background radiation of systemic bias. And so navigating your way to measuring all of those in an intersectional world can be quite challenging. I think a very good example in evaluating what is acceptable is thinking about like motor vehicle reporting. It's generally kind of a canonical thing that on the life side we use. I imagine in P&C it's also quite useful. However, so like motor vehicle reports very useful. You have a history of reckless driving. I'm going to have some thoughts about your likely mortality. At the same time, you do have over-policed communities where you'll get bias in your signal around that. And navigating, how do I correct my data? Can I correct my data? What is the appropriate way to correct my data? Is a large part of the discussion that I think groups across the industry, both in the academy, the society just released a paper on this as well, are having today. I don't have any answers. I think it's a very complicated question, and where we are going to end up collectively is going to be driven by kind of us as a profession pushing things. And then from a regulatory perspective, you see Colorado out front with the regulations they're developing on the life side. But I think you also have a number of states who are fast followers. I think looking at how Colorado is seeking to approach this, focusing on data, focusing on measures will be an interesting bellwether for states that follow in terms of the viability of that for actuaries and for companies. So that's kind of the very long way of saying it's very complicated. There's a lot of things to consider, particularly as you're looking at things over a very large span of time and cases where there's a multitude of biases at play, a multitude of like identities and intersectionalities that make those relationships even more complicated and difficult to predict. And it is just a huge topic of conversation rather than kind of a foregone conclusion on the life side.
Thank you, Julia. So we might have a couple of minutes for questions. So I do want to remind the audience to put your questions in the chat. And while you are furiously typing, I am just going to share one more screen, one more slide for you all. So a few of our speakers mentioned some of the resources that are out there, as well as some of the different ways to get involved. And we want to leave you with some more information on how you can learn more and get involved. So the American Academy of Actuaries has a few different committees or task forces working on these issues: the P&C Racial Equity Task Force, the Underwriting and Risk Selection Committee, and the Life Practice Council, and the Health Equity Committee. And all of those groups have been putting out issue briefs and papers and a ton of resources as well that are great educational opportunities for anybody who's looking to learn more. The CAS has a research paper series on race and insurance that Lauren kindly plugged. And the SOA recently published a report called Avoiding Unfair Bias in Insurance Applications of AI Models. And then if you're following the regulatory developments, the National Association of Insurance Commissioners has a special committee on race and insurance, a big data and artificial intelligence working group, and a committee collaboration forum where many of those groups come together to discuss these issues and collaborate as it is said. So I really encourage all of you to check those out, get involved. We can share this with the NAWA organizers after this session. And with that, I will open it up for maybe 1 or 2 questions before we pass it back to Sandy to close us out. So are there any questions in the chat?
I guess we answered them all, huh? That was a good sign.
Yeah, so this is a big issue. I might ask the speakers, are there any other resources that you can think of that people might consider checking out, things that you've read that have been useful to you?
Yeah, I would definitely read, Google the National Institute of Standards and Technology. They put out a whole nice paper on bias and the way they approach it. And also, the Data Science and Analytics Committee of the American Academy of Actuaries is also producing a lot of papers related to bias, natural experiments, defining bias, and other papers. So stay tuned for papers that we produce out of that committee.
Thanks, Dorothy. And I saw just a comment from Sandy in the chat that it is interesting to hear how something like motor vehicle records can impact multiple different practice areas and industries. I don't think we all necessarily think about that. And so it's important to know how sort of multidimensional a lot of these things are. And I'll also call out one other comment in the chat about bias, right? That the people who tend to learn about biases tend to think they're less biased than others. Maybe not. I saw Dorothy shaking her head no. I personally think that this is one of those situations where for me, the more I learn, the more I have to watch out for myself and the more you start to see happening around you. So hopefully that was eye-opening for all of you who are attending today. And I am going to go ahead.
That Daniel Kahneman that's a great book. He's a cognitive psychologist. Not all biases are bad. We have to stop associating biases with bad things, because as humans, if you study psychology or any of the social sciences, we need them for our own emotional health. If we cannot get rid of cognitive dissonance without having some form of bias to operate. So we have to be careful when biases start to harm people. That's when you really need to, from a cognitive standpoint. But then there are also systemic biases. There are some biases that are bad, but we have to stop thinking every kind of bias is bad. So, remember that the next time you have to digest a lot of information, you cannot digest every single word. You need generalizations.
Thanks, Dorothy. With that, I think I'll just thank the speakers one more time. So thank you to Dorothy, Lauren, Julia, and Stacey, and to everyone here for listening to us today. And I'll pass it back to NAWA board member Sandy to close us out.